I'm joined now by Professor Srinath Reddy, who is the co-chair of this year's conference, and he also heads up the Public Health Foundation in India. Professor Reddy, thank you very much indeed for joining us today on Global Health TV. We very much appreciate it.
Thank you.
Now, we're talking about the changing face of health provision in the developing countries. How is it changing?
For many years, it was considered that the developing countries had mainly the health problems of infectious diseases, poor nutrition, unsafe pregnancies, resulting in very high maternal and infant mortality rates, deaths from malaria, tuberculosis, and now recently from HIV/AIDS. So chronic diseases like diabetes, heart disease, cancers, these were not considered to be important health problems at all in these countries. Now we recognize that these countries, the low and middle income countries, are also experiencing a very high burden of these chronic diseases, even as they are still confronting the old threats. While there has been some success, and depending upon which continent we are talking about, Africa or Asia, in reducing infant mortality and maternal mortality, in reducing the burden of some of the infectious diseases, we are finding that the new threats, both of chronic diseases as well as some of the emerging infections, are now becoming important public health challenges.
Some of the solutions you're talking about are expensive, aren't they? Is funding an issue?
Health care, in terms of providing therapeutic services or diagnostic services, that's going to be very expensive for these diseases. On the other hand, prevention is not going to be very expensive, because much of prevention lies in other sectors other than health and can have a population-wide impact. For example, if you raise taxes on tobacco, by raising prices you can reduce consumption. And this is particularly effective in reducing consumption or preventing the uptake in young people and poor people who do not have very high disposable incomes. So they feel the pinch of a raised price and they give up tobacco very quickly. Similarly, you can take action on promoting healthier foods and reducing the consumption of unhealthy foods by policy instruments like mandating reduction of salt and unhealthy fats in processed foods. All of this doesn't really require much of expense for the government. In fact, by raising taxes, you may gain revenue which you could spend on health care. On the other hand, if you were only to limit your response to health care after the diseases have occurred, then it's going to have a very high price tag and it's going to become very unaffordable for a health system which still has to address some of the unfinished agenda.
What does all this mean for donor countries, and do they have to change the way they provide funding?
Unfortunately, the donor countries have been very much dependent upon vertical programs as their line of funding. In fact, they have funded programs in HIV/AIDS or tuberculosis or malaria or sometimes in maternal and child health, neglecting the need to strengthen the health system overall. This has actually had, unfortunately, multiple disadvantages. Firstly, you can't force fit a vertical program into a weak health system. It will not deliver. Secondly, there is the opportunity cost of trying to drive the entire health system to pursue the goals of that vertical program and neglecting everything else. So if the donor countries recognize that they first need to strengthen the health systems in the recipient countries and try and integrate as many of the disease control programs as possible, then they're likely to get much better results across the board. On the other hand, you are likely to get an initial positive response for a vertical program, and then that will have diminishing returns, and everything else will get neglected as well. So the donor countries will have to readjust their funding framework.
Professor Reddy, thank you very much indeed for joining us today on Global Health TV. It's been a real pleasure. Thank you.